We'll get started. Hello, everyone. Hello, hello. Welcome. We really are excited to have all of you from literally all over the country. All the states and territories look like they're represented. I've been watching everyone come in. And I'm so glad that you're here with us as we're talking about in this part of the COVID-19 webinar series, taking a close look at face masks and folks with disabilities, people with disabilities. And there's a lot to think about here. And we have definitely heard from all over the country that this was an important topic. And we're thrilled to be doing this presentation today with all of you. I'm Carolyn Phillips. And we'll move to the next slide. I am honored to serve as the Director of Tools for Life. And I am so glad that all of you are with us. And so I work at Georgia Tech with Liz Persad at the Center for Inclusive Design and Innovation. And I also serve as the Director of Tools for Life. I'm thrilled that we have Heather Johnson, who's on our team. She's doing the captioning, and Liz is going to talk to you about that in just a moment. And also very happy to have our colleague Hannah with us today, who's our interpreter. So thank you, Hannah. I'm going to turn it on over to Liz, and she'll introduce herself. Liz?
Hey everyone, I'm Liz Persad. I currently serve as the co-principal investigator for this wonderful project that we're working on with the CDC and CDC Foundation. But every day I serve as the program and outreach manager for Tools for Life, which is the assistive technology program here in Georgia. And as Carolyn said, we're all part of the Center for Inclusive Design and Innovation at Georgia Tech, and very excited to be on the line with y'all talking about this important, very relevant topic. I wanted to share a couple tips about today's session before we jump into our content. I wanted to let everyone know that we are recording today's webinar. The webinar recording, the transcript, the accessible PowerPoint, any other supplemental materials will be made available to anyone that needs to view the recording. We'll be posting that on our website, and we'll be sending out messages so everyone can access it. As Carolyn said, we have the wonderful Heather on that is providing our captions today. You can click the show subtitles, or you can click on this specific link to view the stream text of the full captions. And we'll get one of our co-hosts to put this link in the chat so those of you that need it can access it. We just ask that if you're not actively speaking to please mute your microphone. Those of you that were introducing yourself as you came into the room in the chat window, thank you so much. Please use that chat window throughout our time together to ask your questions or to post any comments throughout today's presentation. Carolyn, myself, as well as others on the team will be keeping an eye on that, and we'll be reading some of those throughout today's time together. We will have an opportunity at the end of the session for anyone to raise their hand, use that feature for a Q&A portion, and we'll also be going through questions that are in the chat area as well. I wanted to let folks know that we do have a record number of people on today's webinar. We're very excited about it, so we will certainly do our best to get to everyone's questions. But if you absolutely need us, you know how to reach out to us, and we'll have somebody type in our contact email address as well. Very thrilled to tell everyone that we are offering continuing education credit for this webinar, as well as all webinars in this particular series. CEUs and CRCs are the ones that we are offering. CEUs are approved and distributed by the AAC Institute, and CRCs are approved and distributed by the Commission on Counselor Rehabilitation Certification, or CRCC, as they're more commonly known. If you're interested in receiving CEUs and or CRCs, hopefully you indicated that on your registration, but please reach out to us, training@gatfl.gatech.edu. And again, we'll have somebody pop that in the chat as well. Anybody who's eligible for credits will typically receive their credits within 2 to 6 weeks after this live webinar. So just be on the lookout and reach out if there is anything that you need. All right, Carolyn.
All right, thank you so much, Liz, really appreciate that. And yes, so thank you so much to our funder, we have absolutely enjoyed working with the CDC Foundation and making this webinar series possible. So thank you very much to also the Centers for Disease Control and Prevention for the technical assistance that they have provided. We, as you heard, Liz and I were saying that we are from the Center for Inclusive Design and Innovation here at Georgia Tech in the College of Design. We are really focused on all things accessibility, and this has been incredibly exciting to be able to apply our knowledge to this area of public health and working partners literally all over the country. We specialize in accessibility consulting and ICT, information communication technology consulting, so websites, making those accessible. Also doing UX, user experience testing, and focus groups and all of that around accessibility. We provide Braille services and are thrilled to have been able to work with the CDC Foundation to get so many materials into Braille formats, and they are actively in the mail going out to states and territories as we speak, which is great. Getting information about COVID-19 to the folks who need it. We also specialize in that area of serving folks who are deaf and have hearing-related disabilities through captioning and described media services. And then we provide an amazing service when it comes to e-text, electronic text, and making all these materials accessible. We also have a certified assistive technology team. Tools for Life is the program that falls under. And so you'll hear more about that. Some of the solutions when it comes to wearing masks actually have come out of our Tools for Life team, brainstorming, problem solving, and really working with folks. So some of what we're going to be sharing with you is stuff that we've actually come up with and that we've tested and we looked at. So we're thrilled to be celebrating 30 years of Tools for Life. And so welcome, and we'll move to the next slide. So our session today, it really is, as I started out, are looking at, all things when it comes to COVID-19 and really looking at masks and how all of that can help individuals. So our description here, in order to reduce the spread of COVID-19, the Centers for Disease Control and Prevention, CDC is how you'll hear us say that, and many state and local governments recommend wearing a mask, a face mask, or face covering in public spaces, and around folks, around other people who don't live in the same household. In addition to other prevention measures, such as hand washing, right, social distancing, and some disabilities make it more difficult or even impossible to wear a mask. And so we're definitely going to be talking about that. Some individuals with mobility movement disorders have difficulty putting it on, also adjusting and or removing it without assistance. So this webinar is really going to outline what the CDC face mask guidelines are and explore some of those solutions so we can really help folks problem solve here. And some of the challenges that people with disabilities experience in attempting to follow the guidance. You're going to receive tips and resources and guidance. And as we said, you can always reach out to us and we can definitely continue the conversation. So the learning objectives are pretty well defined here. So upon completion of this webinar, we absolutely hope that we want you to be able to describe at least 3 challenges that individuals face when it comes to wearing masks, be able to list 3 tangible solutions, challenges regarding face masks, and be able to tell folks about that. And
breathe, and certain people with disabilities can't wear a mask.
Yes, that is true, and we'll definitely be getting into that. We've got some slides that we're going to address in just a few minutes about that. And then we also are wanting to make sure that y'all can identify some of the resources that are out there to help support health for folks with disabilities, individuals with disabilities. So we've got a lot we're going to be covering today, and really excited to be covering all of this with you. So when we're talking about COVID-19, the virus and the disease, the pandemic we're facing, it is caused by a virus. Some people, aren't, totally sure about some of the things that the way that all of this comes about, but there's a lot of good information out there. And when we're talking about the virus, as we're moving through this, it's severe acute respiratory syndrome COVID-2. So SARS-CoV-2 is, when we're talking about the virus. The disease it causes is called coronavirus disease 19, or COVID-19. So understanding the virus and the disease as we're moving through this. So there's a lot of evidence of the effectiveness of masks. And when we're talking, I like this next slide. It's got an image that says buckle up, and there's a slash through it, mask up, mask up. The life you may save may be your own. So researchers analyze the information from 44 mask studies involving more than 25,000 folks from 16 different countries. And what they found is that wearing a mask reduces the chance of infection by more than 80%. That's a high percentage. And combined with hand washing and social distancing, the reduction is even greater. So that's part of why we really want to take this moment, take this time, and explore all of this and really help come up with and share some of the solutions with you. The next slide, I think sometimes looking back is helpful. And this is an image from 1918 where there is a group of folks. It's a black and white photo. It's got the caption underneath that says California 1918. And all of them are wearing masks, a mixture of men and women. There's one person who's wearing a mask where their nose is hanging out. That's not how you should wear a mask, right? So as early as 1918, we knew masks worked. We knew, they were important. And we had mask mandates back in 1918. And yes, some people wouldn't even cover their noses back then. And so thought this was an interesting moment that they captured in 1918, especially in light of what we're facing today. The next slide, we're actually talking about that masks are one of the key parts of protection. Masks really offer protection to you and all of those that are around you in case you are unknowingly infected, which does happen with the virus that causes COVID-19. We know folks are positive and they don't know that they have that. A mask is not a substitute for social distancing. So we want to make sure that we express that and that you're aware of that. Masks should still be worn in addition to staying at least 6 feet apart. Hand washing. Wash your hands with soap and water for at least 20 seconds. There are some really cool technologies that we talked about in our first webinar that actually, you could use it with a watch. There's an app that will actually count out those 20 seconds. You can sing happy birthday, twice. And so, that 20 seconds is important. And use hand sanitizer with at least 60% alcohol after touching or removing your mask. Sometimes people forget that. So we want to make sure that folks are aware that even as you're touching it or removing it, that you need to wash your hands. The right kind of mask, worn properly, combined with social distancing and hand washing, really does help to prevent infection. All of these slides, you in this webinar, you'll have access to, and so please do help us spread the word about all of this, and know that there's good information throughout this that you can definitely share with other folks. One of the questions, actually, we just heard somebody asked, does everybody have to wear a mask? And there's some good guidance, once again, from the Centers of Disease Control and Prevention, CDC, on who should wear a mask. The guidance says everyone 2 years of age and older should wear a mask in public settings and when they're around people who do not live in their household. Individuals caring for someone who is sick with COVID-19, whether they're at home or in a non-healthcare setting, they should be wearing masks. And anyone who is sick with COVID-19 or thinks that they might have COVID-19 should wear a mask when they need to be around other people or even animals in their own home. So that's, part of what folks need to consider, and it's good to know that. The next slide is about who should not wear a mask. The CDC recognizes that there are specific instances when wearing a mask may not be feasible. And in those situations, considering ways to adapt the mask and or alternatives, when children are younger than 2 years old, when anyone's having they have trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove a mask without assistance. So keep those things in mind. Wearing a mask may be difficult for some people with sensory, cognitive, or sometimes behavioral issues. If a person's unable to wear a mask properly or can't tolerate a mask, they shouldn't wear one, and adaptations or alternatives should be considered. And we're definitely going to share more of that in just a moment. So we wanted to also think about CO2 levels. A lot of times, and I've heard this even recently, and it's a common misconception that wearing a mask, it does not raise the carbon dioxide, CO2 level in the air you breathe. A cloth mask does not provide an airtight fit across the face. The CO2 level completely escapes. The CO2 escapes into the air through and around the sides of the cloth mask when you breathe out or when you talk. The CO2 is small enough to easily pass through any cloth mask material. In contrast, the virus that causes COVID-19, it's much bigger than CO2. So it cannot pass easily through a properly designed and properly worn mask. So we wanted to make sure that we cleared up that misconception also. Liz, would you like to jump in on the next few slides? And I'm happy to jump right back in.
I would be happy to. Thank you, Carolyn.
Yeah.
So the next few slides, we're going to talk about what type of mask is appropriate. There are different types of masks out there. We probably all own a number of each of them. So let's go through and just talk about the differences and just some of the details with each of these different types of masks. So cloth masks, that seems to be one of the ones that are most popular. The most effective fabrics for cloth masks are the ones that have 2 or 3 layers. You definitely want to stick with tightly woven fabrics such as cotton and cotton blends. And obviously with the cloth masks, they're very breathable. Upper left corner of this slide kind of just shows an animated image of the 3 layers of what a cloth mask could look like. And so less effective cloth masks, there are some out there that exist, and so we want to stay away from loosely woven fabrics such as loose knit fabrics. If you look at the little adorable animated image over on the right hand side, there's an image there of someone wearing a mask, and you can tell that's just not a tightly woven fabric, so we want to stay away from that. Difficult to breathe through, such as plastic or leather. Let's not do that. Let's not have a leather mask or plastic or anything like that. A single layer, example, t-shirts, bandanas, or net gaiters. Again, these are all ones that we want to move away from. These are definitely deemed less effective. Non-medical disposable masks. These are good ones. Disposable masks are single-use masks, so it's very important to keep that in mind that we wear them once, and when we're finished, we remove them appropriately and throw them away. These are not the same as surgical or other medical masks, and some of you may be familiar with the N95 mask. You may prefer using a disposable mask in situations where your mask is likely to get wet or dirty. Again, these are disposable, easy to take on and off, and you just throw away. As with the cloth masks, You want to make sure that your disposable mask fits closely to your face without gaps on the sides or the top or the bottom, and that it completely covers your nose and your mouth. I keep a little COVID bag with me. I use a power wheelchair. I've got a bag on the back of my chair, and so I got a little COVID kind of prep bag if I have to head out of the house or go on running errands or what have you. I've got extra disposable masks in there, sanitizer, wet wipes. So definitely encourage you, if you are using these disposable masks, just keep extra ones with you on your person any given time. Put them in certain areas on your car, in your bags, and what have you. That way they're just always with you. So masks for healthcare workers. We definitely advise do not use surgical masks and N95 respirators or KN95 masks that are meant for healthcare workers. We all have seen on the news and just know information that surgical masks and respirators are very critical supplies, and oftentimes they can be in low demand. So we want to make sure that we're keeping these reserved for healthcare workers and other medical first responders, so that we're all helping to prevent supply shortages during this time. There are some masks out there with exhalation valves or vents, and we wanted to draw attention to that. The CDC does not recommend using masks with exhalation valves or vents, because this particular type of mask doesn't really prevent you from spreading COVID-19 to others. The hole in the material may allow respiratory droplets to escape and reach others. So again, it's not a secure way of wearing a mask. You're allowing your droplets to reach others and escape out. Research on the effectiveness of these types of masks is still ongoing, but again, CDC recommendation is that we stay away from these types of masks with those exhalation valves or vents. And Carolyn, did you want to cover this?
Yes, absolutely. Happy to cover this. And it looked like that a few folks had some points about this already in the chat, and absolutely correct that the ADA does. And when we're considering that, when we're looking at masks, there's a question here. Does the Americans with Disabilities Act, ADA, exempt people with disabilities from mask mandates? And if a person with a disability is not able to wear a mask, state and local government agencies and private businesses must consider reasonable modifications to a face mask policy, so that the person with a disability can participate and or benefit from the programs offered or goods and services that are provided. That's important to know. Some examples of modifications, they include businesses offering curbside delivery of groceries and meals to the car, healthcare providers offering telehealth visits where possible, allowing people to remain in their vehicles until the time of their appointment to minimize contact with other individuals, and also offering online ordering with home delivery by third-party services. So those things are very important. The next slide, we're actually talking about when businesses do not have to accommodate individuals with disabilities. After exploring ideas for reasonable modifications, there may be rare, and we mean that, very rare instances when it is not possible to accommodate an individual. A business doesn't have to provide a requested modification if doing so would create a direct threat to individuals that work there, the employees or customers, and or a fundamental alteration to business practices. So, thinking those things through. We do know that masks, there are challenges here for people with disabilities. And we also know, that mask challenges, when we're talking about folks with disabilities, and we'll move to the next slide, that this term of disability, it's very broad. There are literally millions of folks that have all types of disabilities. I'm one of those folks, and not all disabilities are visible. You can't see everybody's disability. And many individuals with disabilities, they have difficulty wearing masks or specific types of masks. Not all people with the same disability respond the same way, and we need to keep that in mind. If possible, even those unable to wear a mask, unable to wear the recommended mask, should seek an alternative form of protective covering. And we're absolutely going to be talking about that. So when we're talking about, for example, folks who are deaf, we know American Sign Language, one of my favorite languages, ASL, it is very visual, right? It's heavily dependent, not just on the hand signs, but also on the facial expressions. Deaf individuals who communicate with sign language or use lip reading can't always communicate effectively if you have a mask covering, their face or what have you. It's really about the communication. This is a true, thing to consider when we're thinking about social situations, stores, healthcare situations, and other places of business. So keeping those things in mind. On the next slide, we were also, and this is a question we've had quite often, there are so many folks that wear hearing aids, and so considering all of that, there was a survey of older adults with over-the-ear hearing aids identified several difficulties associated with wearing a mask. They had discomfort, and I've heard that, of over-the-ear mask loops in addition to their external hearing aid. Risk of losing the hearing aid, which gets entangled sometimes into those mask loops, and difficulty hearing speech from others because it's muffled behind the mask, right? So thinking about all of those things. So there have also been a lot of challenges for people who have low vision or who are blind. While most blind individuals or individuals who are blind can wear masks, they also have expressed some issues, and we've heard about that, and we've definitely talked with folks. So it could be locating the personal mask, differentiating their mask from others within the household. That's also can be an issue, and avoiding possible contamination to their mask. So those are some things to consider. Another challenge is people that have very small ears or no ears. So putting on a mask and keeping it in place. So what we have found is the most common solution here, the ear loops is not necessarily possible. And so problem solving for that. Another area that we have to be thoughtful about is when we're thinking about cognitive, sensory, behavioral related disabilities, thinking about all of that. Some people of any age with certain disabilities, they may have difficulty wearing a mask. And these factors that could be contributing to this include sensory to certain fabrics. We've seen that. Inability to avoid frequent touching of the mask and face, right? Inability to, limit sucking, drooling, sometimes having excessive saliva on the mask can also be an issue. And inability to actually put on and remove the mask without assistance. So some of the folks that have reached out that have expressed these concerns specifically, they're within those, the areas of folks that have autism, sensory processing disabilities, post-traumatic stress disorders, even fibromyalgia and chronic fatigue syndrome. So, there's a lot to consider with all of this. The other area where we're seeing a lot of questions and a lot of people reaching out, it's children, but also children and adults with seizure disorders. Not being able to see someone's face and could be a safety issue if they have distinctive pre-seizure facial expressions, and it's important to be able to see those. Also, a significant percentage of children that have autism also have seizure disorders, and we're aware of that. So thinking about all of that, in addition to you know, some of the other issues when it comes to trauma survivors, people with post-traumatic stress. The mask may feel like it's suffocating. I've actually heard that from folks, or create an immediate fear of impending doom. So it actually increases anxiety. Seeing a mask on someone else may be a reminder of a perpetrator. So thinking about all of that. Um, there's a quote here, and it's speaking directly to this. And so is a woman, and she said it immediately reminded her of when she was deployed in Afghanistan in a confinement situation where she couldn't breathe, and the mask triggered her post-traumatic stress disorder, dealing, you know, thinking about from her service in the military. So thinking about all of those various situations, and that's, you know, part of what we're talking with you about. So as to the next section, where we're talking about masks and adaptations and alternatives for people with specific disabilities, we definitely want to let you know we're thinking about how to problem solve this. And so on the next slide, we have an image here where we have folks who are wearing cloth masks, and then there's a very clear area. They're wearing two people and they have black masks, and then clear so that you can see the lips. And so we know that clear masks can benefit individuals who are deaf who sign, people with hearing related disabilities who are reading lips, teachers, caregivers, family members, and friends. The things that we want to make sure that everyone's considering with this is making sure that the user is able to actually breathe easily, doesn't have excessive moisture collect inside the mask. I've seen that where some of them can fog up. I think they're getting better though. And then removes the mask before sleeping, since the plastic could be part of a seal around the mask and nose, and so it could make it hard to breathe. So thinking of all of those important considerations. Another thing to think about when it comes to clear masks, they can also help others who need to see faces. So that includes infants who are learning, you know, from visible facial expressions, very young children who are learning language and emerging into language, students who are learning to read, students learning a new language, and then also people who need to see the proper shape of the mouth for making appropriate vowel signs and singing, etc. So all of those things are important to consider. When we're talking about the, you know, clear masks and all of that, a lot of folks bring up, well, what about face shields and goggles? The CDC does not recommend using face shields or goggles as a substitute. Early on, I saw that folks were doing that, but it's great because we're seeing a lot of folks, if they're using a face shield or goggles, they are indeed now using a mask. So do not put a plastic face shield or a mask on newborns or infants. At this time, it's not known how much protection a face shield really does provide to folks that are nearby. However, when wearing a mask is not feasible in every single situation for some people, it does provide that limited barrier. It's not a replacement for the mask, as we said. The face shield and goggles are primarily used to protect the eyes of the person wearing them. The goggles don't cover the nose and mouth, as we know. And so face shields, they have a large gap sometimes below and also alongside where respiratory droplets could escape. So a lot more that needs to happen in that space, but so that's, we wanted to make sure we share that. Clear hoods, that's another thing that I think a lot of us have seen. And so clear hoods, they afford limited protection to children who cannot wear masks, especially exposure to the virus from greater height, as somebody who's, you know, up higher, and for minimizing touching of faces and eyes. So they're not, once again, a substitute for masks for children who can tolerate a mask. So if the child can tolerate a mask, then that's the best solution. The expanded facial visibility may facilitate, early identification of seizures. So keep that in mind, as we were just talking about, for people who cannot tolerate masks. And then full over the head hoods with closings may be an alternative for some individuals who can't tolerate fabric touching their skin. We have seen some success there. So thinking about those solutions too. Identification, as we were sharing with you, for our friends and colleagues and family members who have vision-related disabilities or who are blind. What we have found is that high contrast masks with solid colors or masks that have a textured fabric can make it easier to locate for some folks with vision loss, but also to identify that this is mine and that's yours or what have you. Masks with different styles, shapes, textures from other members of the household, that's really helpful, and it allows people who have low vision or blind to be able to distinguish it. And so thinking about that. Just a couple of tips here for sorting. You can get 2 small bags with different textured or containers with different shapes to separate clean from dirty masks. So that's a strategy to consider. Also, putting dirty masks in a small mesh laundry bag so that they can be washed, laundered, what have you, and going ahead and separating that. So there's several strategies that we've explored and have found to be successful here. So another thing, when we're talking about some of the issues when it comes to our folks that have hearing aids or people who may not have ears, using a behind the head fastener or extender can really help. And that can be the problem solved right there as an alternative to the ear loops. And I've actually found for some of our folks that we work with who have sensory related disabilities that can also help. So behind the head fastener or extenders, they benefit individuals without ears or very small ears. They also help folks who find those ear loops uncomfortable. There are some masks that I've used where I find it uncomfortable. And people who risk having mask loops entangled in their glasses or headphones or hearing aids, what have you. So it solves the problem for a lot of folks in a lot of different situations. Another alternative to the ear loops, when we're talking about the mask adaptations, it really is all about anchoring those loops. So think about it from that perspective. And there are some really creative solutions out there. You can make an extender to connect the loops behind the head. That could be a large plastic or a vinyl clip. It could be a ribbon. It could be a ribbon with buttons. You can also use wider elastic or fabric ties with elastic inserts across the back of the head instead of the ear loops. There's some pictures here that are demonstrating that and showing that. There's a picture here that actually shows the way that a plastic device that's S-shaped is used to where the mask loops, the ear loops are being held that way. And then also examples of the buttons. So attaching the ear loops to a headband, there's a picture here that shows that, or a bandana, where just buttons have been sewn onto that headband. My daughter actually has one of these solutions. And it can also be used with a cap, a ball cap. Where you can put the buttons and then use that as the loop. And then using ties instead of the elastic loops so that it actually goes all the way around. So lots of solutions and things to consider here. So Liz, I'll turn it to you.
Sure. So we're going to talk a little bit about strategies for caregivers of those who have difficulty wearing masks. So if any of you are out there that are actually serving as caregivers, have family members, other colleagues that maybe you assist. These are just some helpful tips. So obviously we, first and foremost, highly recommend that you ask your healthcare provider for advice. They're going to be able to just give some helpful tips and strategies to work around that difficulty. Ensure proper mask size and fit of the mask. Obviously, that's going to make it so much easier for someone to put it on, take it off, and just be wearing it for extended periods of time as well. It's important to prioritize wearing a mask, especially when it's difficult to keep at least 6 feet apart from other people. So for example, during carpool drop-off or pickup, or when standing in lines at school or at the store. So just thinking about when is the most important to wear a mask and prioritizing those times. It's important to remember to remove the mask from the person before they go to sleep, or if they're taking a nap, or if they may fall asleep. So if somebody's using a car seat or stroller, or again, just doesn't have that physical ability to remove the mask themselves, just be mindful of all that. So again, just want to be mindful of folks being safe, especially when they can't physically themselves maneuver the masks. So we have a couple of resources here for masks, where to buy disposable masks or cloth masks. Cloth masks are widely available online through mass shopping platforms. You can get them on Etsy. You can look for different designs and different types of masks on Pinterest, especially, choosing those made from tightly woven fabrics. Just to reiterate, we want to avoid knits, plastic, vinyl, as we mentioned before. Always, it's important just to reiterate, you want to make sure it fits over your nose, below the mouth, and fits snugly against the sides of the face. Keep those gaps away. Make sure it fits snug. Disposable masks are widely available in local pharmacies. Online, you can get things on Amazon. They're really available. Clear masks and shields and hoods can be purchased online. And as I'm just glancing at the chat, some folks have actually shared some really helpful resources. So definitely encourage you all to take a look at all of that. Other resources, patterns for masks. If you sew, or you have a family member who loves to sew, or you are part of a sewing group, doing this allows you to make it personal. It is more fun when you're able to go shopping online and pick out fabric for things that match your outfits, and that makes it fun. Or if you want to show your team spirit for your school or other professional sports teams. So just think about making it fun and making it personal. Numerous versions of cloth masks have been introduced this year, patterns and directions in print or on video. They're all available online, so highly recommend just checking all of those out. So yeah, lots of great information there. There's some tips for makers, people who sew, who quilt, who craft, who have been able to fill in the needs there of creating masks, sewing them, and shipping them out. So just definitely encourage you all to just dive deeper into some of those resources as well. Fabrics for masks. Where do you buy cloth for masks? Again, we want to encourage you all to search for 100% cotton or 60% polyester, 40% cotton blend fabrics at fabric stores. You can go to Joann Fabrics, Hancock Fabrics. You can look online as well too. Some chain stores have fabric sections, Walmart, Hobby Lobby, Michaels. Avoid those decorator fancy fabrics. Even if it's all cotton, they can be really heavy, may not be terribly flexible, and can just be uncomfortable wearing on your face. Local online quilt shops are good sources for 100% cotton and in many patterns in colors. So examples can be Keepsake Quilting, Missouri Star Quilt Company, Jordan Fabrics, Hancock's of Paducah, many more. So just some great resources there. And we also just encourage to think of alternative ways. You could buy a set of 100% cotton pillowcases to make a few masks as well too, and they come in all sorts of colors and fun patterns. So just some great resources there for fabrics. Thinking about where you can buy elastic for the ear loops and nose pieces. Most ear loops are made from a 1/4 inch elastic. You want to avoid wider elastic that can get really uncomfortable. Some wearers find jewelry elastic, thin round elastic more comfortable. This elastic is a 1/2 inch or 3/4 inch wide, but is better for extenders. Elastic that's sold in small packages, usually 2 or 3 yards, or by the yard in some online stores. Elastic can be found in some chain stores. And then also some people find elastics to be very uncomfortable, especially if you've got to wear a mask for an extended period of time, especially if you don't have the ability to take the mask on and off yourself and somebody is setting you up, you know, for a while, it can be very difficult. So another helpful tip is some mask makers buy children's tights, leggings, and cross-cut sections to make soft air loops. The knit edges of the loops are not hemmed, but they are allowed to kind of roll that specific fabric. So just again, some helpful tips when it comes to elastics and alternative ways to hook it around your ears. Nose pieces, these are optional. You can find soft aluminum nose pieces for sale online. Again, you can try places like Amazon. All right, so I know that there's a lot of chat happening, a lot of questions, a lot of comments. Y'all have been very helpful just answering each other's questions and just sharing lots of resources, personal stories, and what have you. I know that we're going to have some of our team possibly read out some questions as well too. While folks are getting some of those questions pulled up, I just wanted to remind everyone of additional webinars that are coming out in this series. So we're very excited to bring all of these to you on December 16th. We are going to take a closer look at mental health and resilience within the disability community during COVID-19. So very excited about that one. That's just happening next week. And then we'll be resuming with our last two webinars in the new year. In January, we'll be talking about making social media accessible for people with disabilities. And then in early February, we'll dive deeper into guidance for businesses and employers, especially when it comes to considering the needs of people with disabilities during COVID-19. So, Carolyn?
Yes. Oh, excellent. And I am really appreciative of all the great information. And and thanks for all the positive feedback. I'm so glad to hear that this is helpful information. And I hear you definitely on, you know, the colors and all of that, you know, making the masks fun. Just like you were saying, Liz, and I see that's happening where some people have suggested that within the chat. Also, I agree about the fogging. I think that's early on been a big issue, and right on about the way that some folks have been able to solve that with nose clips or, you know, the little glass clips or what have you, so that our glasses don't get foggy. Yeah, and I think also just helping people understand that once again, not all disabilities are seen. You know, they're not all visible, and there are absolutely barriers for some folks in helping problem solve and offering some of those solutions. There was a comment in here. It looked like somebody wanted to blog about this. Absolutely. Feel free to do that. And we would love it if you share that with us. As I see it, you know, I absolutely love being a part of this community, our community, and the more that we can get the information out and learn from each other, the better. It's one of the things I love about our work here at Georgia Tech, and also our work within the disability community, is that we're problem solvers. We all are collectively brilliant. And so helping solve all of these challenges that exist out there. So are there some questions? Sam, I think you were going to read some to us. Yeah. So absolutely happy to answer any questions that you have, and happy to get back with folks too if we can't answer the question immediately. So Sam, what have you got?
Sure, if anybody has any questions, feel free to put those in the chat and we can try and get those answered for you.
Sam, I do have one. This is Tori with CIDI. We had one come to us directly to the host. And it asks, our local health department is requiring us to wear N95 masks, but the ones we have are very large. I have gaps above and below my chin and nose. Can you buy these in different sizes, and how effective are they when they are this large?
That is a great question. And yes, so the masks do actually come in different sizes, and being able to get the right fit is important. Often with the N95, and sounds like, definitely in healthcare situations, that's important. Clearly, we want to make sure that our, because of the critical need out there, that the, frontline and healthcare folks do have the N95 masks. But yes, making sure that you can get the right fit. So yes, you can get them in different sizes. Straps often, just the adjusting it can be very helpful too. Yes, and I'm glad you're advocating for the right fit and the right size. We definitely hear you.
And a follow-up to that question was, we were also told by our employer that these masks can be worn many days or even months. Is this true?
So that is, yes, I can definitely, we'll look that answer up and absolutely look more into the guidance. I know there's been a lot of discussion around that. And it's not always, the recommendation. So we'll definitely look that up and we'll get back with you about that. Important question, definitely.
All right, we have a question from Julian that says, how do you address families that are not compliant when working with someone who has a cognitive disability, and conflict resolution ideas?
Yeah, so I've been in that situation. I definitely feel for you and also for this situation. What I have found is, it's definitely making sure people have the facts, the information. As we started out this webinar, talking about how significant the positive impact is of having a mask. And then really getting to what's the true issue, what's really happening, and then problem solving for that. That's where some of the suggestions and some of the solutions that we've been able to share have come from. If, for example, somebody doesn't have ears or small ears, let's figure out another way. Let's figure out another way to clip it. If somebody has issues with textures, let's figure out a way. Let's figure out the right texture or what would work. And I think that it's being patient with folks, and then also coming back with solutions. Happy to problem solve that with you. There are a lot of folks that are in the same situation, and we've been able to successfully navigate a lot of that. So, and if you're not speaking, if you could mute, that would be great. Thank you very much. And I hope that helps you. Happy to discuss that in more detail with you.
All right, we have a question from Anna that says, I'm curious about risk benefit for people who struggle to remove a mask independently on a consistent basis. Recommendations are black and white, but mobility is not.
Yes, I definitely understand where you're coming from. And, that's one of the things that's important as we're looking at the guidance. Can you remove the mask independently? There's been some really, I think, cool devices that some folks have come up with, specifically even just to remove the mask and put the mask on. Kind of like reachers or something you would use for dressing. Liz, anything you want to add to this one?
You covered it well, Carolyn. I am somebody that has a physical disability. I use a power wheelchair. I'm unable to lift my arms up to my face. So I am 110% reliant on other folks to help me out with getting my mask on and off, making sure that it's snug. If I have an itch on my nose, anything like that. I've utilized, just when I'm at home, I've got like a little extender back scratcher that I use as a reacher to grab like little papers and things around my desk. I've actually used that successfully a handful of times to pull the loop off of one ear. So kind of low tech assistive technology solutions.
I know.
But yeah, it can be very difficult as well. I think communication is important. Thinking ahead, those of us with mobility issues, when you are physically dependent on others, you're having to keep that, two steps ahead all the time. And so some of those tips and strategies that we were sharing about prioritizing the times and, just keeping those lines of communication open with your caregivers are some of the best pieces of advice I've got now. And maybe just think about some low tech AT solutions. Those are always fun to kind of dive into and see if there's anything out there that could help you, reachers, what have you.
Thank you, Liz. That's so helpful. And I think someone was asking earlier about higher education, colleges, universities, and technical schools, and some of the many challenges that folks are facing when it comes to students with disabilities. Some of them not being able to wear a mask, and what are some things to think about with that? Really and truly, it does come down to the accommodations and reasonable accommodations. And what we have seen and problem solved with folks around the country is coming up with, is there another way for that person to access the educational information? Is there virtual ways to do that so that everybody is safe? And it's important just to be mindful that some of these solutions, it may be coming up with that alternative environment or a different way for the person to participate. Once again, happy to talk with y'all about that and explore any of that with y'all. So great question. Other questions?
I'm reading through, so if anyone sees any questions they want to answer, please feel free to jump in.
As we're collecting more questions, I just want to remind everyone that we are recording. We will be posting this webinar, the transcript, the message chat, and the accessible PowerPoint on our website. And if I can get someone to type in the website for the project, that would be great. And we encourage you all to check out this website as well too. So
we also encourage everybody, there several questions that folks have had. The CDC guidance, it's outstanding, and I'm referring people all the time to the CDC guidance, and we defer to that all the time, obviously. And so you can check out the guidance, and then and we're happy to get back with you if you have other questions. We do appreciate your time today. And Sam, do you see any other questions as we wrap up?
No other questions. I've seen a lot of people ask if we're going to have the presentation archived, and the presentation, this recording, and the transcript will all be archived on our website after the webinar by the end of the week. So be on the lookout for that if you miss anything.
Excellent. Thank you. Thank you all for this positive feedback. I'm seeing so many thank yous, and thank you right back to all of you. We do appreciate you. And I'm going to turn it to Liz so she can give you the survey information, and then we'll move forward. So Liz?
Absolutely. Again, thank you all so much for being on with us. We are just thrilled to have you, and really appreciate the healthy chat resources, comments that are coming through throughout today's presentation. We had somebody share the website where the archive will be posted. I think we can get someone to share that again so it pops up, but we also ask that you click on this link. We'll get this typed up in the chat as well too. This will take you less than 5 minutes, but we want to hear from you about other topics, but how we did, but really and truly just if there are other topics that y'all want to hear more about, especially when it comes to COVID-19 and folks with disabilities in our community. So please take a few moments to fill out that survey. We absolutely would appreciate it.
Thank you, Liz. I always love presenting with you. And thank you to Trish Redmond, who helped us create this content. So thankful once again to our funder, the CDC Foundation. And absolutely appreciate Sam Peters and Tori for working behind the scenes and helping us with all the logistics. Really appreciate Heather Johnson. Thank you so much for this excellent captioning. And Hannah Bull, thank you, thank you, thank you. Outstanding job. So please do keep in touch. Keep those questions coming, and we hope that all of you will stay safe and be well, and let us know how we can help. Take care, everybody.
Thank you.
Thank you. Bye, y'all.